For decades, we have pictured heart disease exactly like this, a rigid metal pipe slowly clogging with sludge. This imagery suggests an obvious cure. A treatment simply needs to scrub that gunk away to widen the channel. Real human arteries are dynamic, living tissue. They are capable of shifting their shape in response to the disease. As plaque accumulates, the artery wall expands outward to keep blood flowing. A massive burden of disease can hide behind a perfectly clear opening. Conversely, an artery that is actively healing often shrinks inward. The disease volume is reducing, but the physical channel looks narrower. Because the vessel wall constantly adjusts its caliber, the size of the opening provides an unreliable measurement of the actual danger. For years, both clinicians and lifestyle advocates used standard angiograms to claim their specific protocols reversed the underlying disease. A traditional angiogram creates a two-dimensional silhouette of the blood channel. This tool remains blind to the wall where the disease lives. This creates a medical illusion. A diet might successfully stabilize a patient's condition, but if the artery constricts while healing, the X-ray suggests failure. Judging cardiovascular health strictly by the width of the channel is a significant error. It has fueled decades of overconfident claims. Finding the truth requires looking past the empty space in the pipe to examine the microscopic composition of the plaque itself. Regression of heart disease depends on changing the physical and chemical makeup of the arterial wall. At a microscopic level, an established lesion is a complex, multi-textured ecosystem with distinct functional layers and textures. The first compartment is a fibrocalcific scaffold. This is a dense, stubborn structural material that acts like arterial concrete. The second compartment is a lipid-rich necrotic core. It is a metabolically active, inflamed pool of volatile fat sitting right below the surface. A heart attack happens when this volatile core ruptures through its fragile cap, letting the contents spill directly into the blood. This biological bomb is primed by a lifetime of exposure to ApoB-containing lipoproteins. These particles relentlessly bury themselves into the artery wall. Survival depends on draining that volatile lipid core until it loses the ability to rupture. To make sense of the conflicting data, we can organize the evidence using an analytical tool called the two ladders. Ladder A covers imaging. It tracks whether a treatment physically changes the size or the interior composition of the plaque. Ladder B covers hard events. It demands proof that a treatment actually stops people from having heart attacks or dying. Advanced primate studies and human trials show that when ApoB levels drop, the dense, calcified concrete of the plaque remains behind. While that hard scaffold persists, the dangerous lipid core clears out. A thick, stabilizing, fibrous cap forms over the remaining tissue. This process is called compositional stabilization. We protect the artery by draining the bomb from the inside out. Moving to human application requires identifying which specific lifestyle interventions actually trigger this stabilization in the real world. Very low-fat programs show signals on the imaging ladder, while Mediterranean-style diets hold the strongest randomized proof for preventing actual deaths. We can find the most effective path by looking at where the data from both of these ladders converges. The evidence points toward a shared core, a shift toward minimally processed plants, vegetables, legumes, and unsaturated fats. This unified protocol minimizes daily exposure to red meats, processed meats, refined carbohydrates, and excess sodium. This plant-predominant pattern remains the primary lever for controlling ApoB and effectively starving the lipid core. Diet and modern medicine are often presented as competitors, but the data suggests they are complementary tools. Diet acts as the lifelong lever. It controls the accumulation of ApoB particles from childhood through the senior years. ApoB-lowering drugs act as a potent downstream lever. They provide a rapid correction once the disease is already established. While past structural scars remain, combining plant-forward nutrition with targeted medicine neutralizes the risk and protects your future.